very delicate patients, typically we find in ICU wards, critical care units. You can imagine you have a person who's in coma or sedated or critically ill, and we'll do a lateral transfer from the bed to the combolizer to perform an early mobilization. You can use the Maxi Sky 2, which is seen in lifter, has a safe working 272 kilograms. You simply use this Maxi transfer sheet, which is not only bed sheets, but it's also a sling. So we don't need to put an additional sling underneath the patient. We simply add this underneath the patient, can lift the patient up at any time without any additional efforts. So when we added all the loops, we'll be able to lift the patient up and perform a transfer. So the additional benefit is that we can cover the patient up with ease. If you have a patient to improve the dignity, respect, and also if they'll be cool and cold. And just by pressing a button, we're able to move the Maxi Sky to the combolizer, which is used for early mobilization of critical ill patients. Apply the brakes, and then we move her here. We simply lower her down on the combolizer. So we simply remove the loops of the stretcher frame. And then we move the sternal lifter away from the patient. We'll strap her up so she will not fall out. And then we collect a Maxi Slide Flight, which is slide sheets, single patient use, that we use to minimize any potential skin shear to the body. We take a slide sheet, we fold it a few times. This is single patient use in order to minimize cross-infection. It's not washable. We fold it a few times. We have done so. We insert it underneath the patient's head, like so. So we put this between her skin and this transfer sheet, so we don't have to move her manually. And we simply unravel. And now we want to remove this Maxi transfer sheet without touching the patient. We tuck it in underneath the patient and simply unravel. We have not yet touched the patient. You can imagine if you have all the lines, tubes, maybe a ventilator, a catheter, IV, pulse meters. We take this, remove this as well. Simply hold it and we remove this underneath the patient. And we tighten up the straps. And of course, by standing her up, we minimize the risk of losing the muscles. So when we stand her up, she can build up the muscle tone again. She will be able to minimize the risk of pulmonary conditions such as pneumonia, minimize the risk of DVT in the legs, blood clots, minimize the risk of blood sepsis, blood infections, urinary tract infections, which is so common. So you have to picture up to 200 kilogram patients who may even be sedated. You can now be stood up to 75-degree angle. And with this, you can also turn to side, 20 degrees. So as if you have fluid, liquids in your lung, you'll be able to minimize complications. Not only in a stand-up position, but also in a seated position. We use this as a transfer chair. And in seated position, you can also turn it 20 degrees either direction. And shoulder protections as well. And then if you do need, then you can do a swift motion into to supine lift, height. If you need to do blood pressure or CPR to get her in the position for that. So there you have it. Very simply done with a very delicate patient in this case. Do a little bit of putting in a seated position. So that is a little bit too tight for her when we do a seated, so we'll just release this a little bit. So up to 200 kilograms, even a sedated person can be seated and stood up. Maybe not seated, but stood up at least. This way.